Thanks so much for joining us on Beauty 411 with Dr. Mary Beth Mudd. I'm Gabe Spiegel. Who doesn't want to look their best and feel fantastic? On this program, we're going to discuss the latest beauty medicine procedures that can change your life. You know, when you're putting your trust in someone who will work on your face, your body, your profile, basically your image, you want the very best. You want a doctor like Dr. Mary Beth Mudd. From a very young age, Mary Beth Mudd knew she liked helping people. Like most kids, it took this little Girl Scout a few years to grow into her own, and she did. Mary Beth has always had a passion for beauty. After high school, she began studying the body. She aced chemistry and biology at Ohio Dominican. Then she earned a medical degree from The Ohio State University. And after her residency at Grant Hospital in Columbus, she delivered babies for 23 years. Now she delivers happiness in the form of beauty medicine. Her philosophy is simple: look in the mirror and love what you see. Speaking of, we have the beauty doctor, Dr. Mary Beth Mudd, with us now. Doctor, thanks for being with us today on Beauty 411. You really love doing what you do.
I do enjoy what I'm doing. I was in family practice and obstetrics for 23 years, and I really enjoyed that. But this is a whole different level of enjoyment, which I've been doing now for the past 7 years. I love helping people feel good about themselves.
And you really do make a difference, but you're not a miracle worker. You're not going to turn me into Brad Pitt overnight.
No.
You try to give folks a sense of reality.
Well, what they have to remember is that Mother Nature and God gave them a certain look. And so what we want to do is expand upon that look, enhance it, bring out the natural beauties that they were given, and let those show to their best advantage.
And you really can make a difference with a number of different procedures. Zeltiq, Ultherapy, we'll talk about those a little bit later, but I'd really like to talk about LaserLipo, a really popular procedure at the New You Center.
It absolutely is one of our biggest procedures. Most people are familiar with liposuction. Liposuction's been around for a lot of years, but it's something that's a surgical procedure. All the things that I do are non-surgical. So you have to go to the operating room, be put to sleep. It's rather traumatic to the tissues. Well, in November of 2006, the FDA approved LaserLipo, which is a procedure that we can do under local anesthesia in the office, and so the person can be awake. There's not the anesthesia difficulties or dangers that are potentially involved with that. But the neatest thing about the LaserLipo procedure is that we are able to do this in not only just melting the fat, so it's a lot less traumatic to the tissues. We're going to melt the fat, sort of like if I put a stick of butter in a microwave, it gently melts. I can put it in the food processor and it chops it up rather dramatically, but we like that idea of melting. But one of the huge advantages that I see in my patients is that we can also tighten their skin. And so the problem we had with liposuction previously is we took out the fat and kind of took the padding out, and so they were stuck with loose skin. Well, now we're able to put heat into that skin, force it to get some instant contracture, as well as develop some collagen over time, and we're able to almost get 2 procedures for the cost and time involved in 1 procedure.
And we got a sneak peek earlier today of a case you were working on, LaserLipo. This is Barbara Hyde Thompson. Tell us a little bit about her story and what you did to her today.
Barbara is an amazing woman. She was able to lose a significant amount of weight, which actually prevented her from several medical problems that are associated with increased weight problems like diabetes and high blood pressure. However, many people, when they lose weight, are not successful in losing it underneath of their chin and along their jawline, so that they still don't like their appearance. They may look heavier than what they are in real life. So what we're able to do is make 3 little tiny openings about the size of ballpoint pen openings, and be able to put our local anesthesia all underneath in this area. And then we put the laser. The laser fiber is smaller than angel hair pasta, so it's quite tiny, but the tip gets hot, and we were able to move the tip around so that we were able to melt her fat as well as tighten up her skin. The last step just involved putting a little tube in and aspirating out the fat that we had melted.
It's a pretty amazing procedure, and it looks pretty involved. Is it painful?
It really is not much pain at all for the patient. They tell me the part they don't like is getting the 3 shots to be able to put the 3 openings in, and they may feel a little bit of poking while we're putting in the local anesthesia. But after that, they're completely numb, and she was quite pleasant and quite happy having me move a hot laser around in her neck area in between the skin and the muscle, and had no pain whatsoever with that.
Neck area, maybe an hour, hour and a half, and you're out the door.
That's right. I think it took us about an hour, 20 minutes for Barbara from start to finish.
Wow, how about that? So downtime, ideally her best results are going to show up in about a month to 2 months?
We actually find that swelling is the #1 side effect, and the swelling will go down by about 60 to 70% after the first month. 90% should be gone at the end of 3 months, and it will all be gone at 6 months. What we typically will find is that their 1 week recheck, people will walk in the door and say, oh my heavens, I can already see a significant decrease because their fat looks better and their skin looks better. In fact, in Barbara's case, she looked better and smaller walking out the door, even with the swelling from the procedure, than she had when she had walked in the door.
Sign me up. Sounds pretty easy. We've got some pretty dramatic results on these before and after pictures. Tell us about these cases.
We have a few patients here who have allowed us to use their pictures who actually were done in the past so that we're able to show a full result here. We can see that they all had some fat underneath of their chin so that they really lost some of the angle of the jaw and had the double chin, the turkey neck that nobody likes to have very much. And by the time anywhere from 1 to 6 months later, you can see significant improvement in the way their neck appears.
The gobbler, get rid of the gobbler. But just so we're clear, the laser lipo is not just for your neck. Where else can we get it?
We can put it in any place where I can put that angel hair pasta-sized laser fibers. So typically we do necks, we do a lot of tummies. Tummies is #1 area that we do, but we also do the love handles for the back. We do thighs, the inner outer thighs, sometimes the knees is an area that people don't like. So I always tell people if we're able to get the fiber in there, I can melt that fat and tighten up the skin for the person.
Now I'm going to be spending lots of time in Dr. Mary Beth Mudd's office.